This is the worst part. That's it. You can feel a little bit of like a fluid. You feel a little bit of a burn. Is it too bad?
Mm-mm.
You're amazing. A couple more of those and you're done.
I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results.
Hi, I'm Sophie. I'm from Los Angeles. I'm a stylist. I feel like you just see everyone in the media with these plump, beautiful lips these days, and it's temporary and just sounds like an easy fix. I've been wanting to do it for, I think, 2 years now, but I've either been too chicken to do it or just haven't found the right doctor. I guess my biggest concern about the lips is that they're gonna look bad on me because I do think I have such a small face and small features, so I don't want it to look too unnatural. Something too big for my tiny face.
Will my lips look too big? No. I like a natural lip that's enhanced in certain regions of the lip so that the lips look natural, full, and attractive. Big, unnatural lips are not my look, and so none of my patients have to worry about that. The good news is the filler that we use for lip enhancement procedures are temporary, which means that they're gonna go away. They're also reversible, so we know that we're gonna get you a lip that you're gonna truly love.
Hello, Sophie. How are you?
Nice to meet
Nice to
you.
meet you. I'm Dr. Dhir. Welcome to the office.
Thank you. Thanks for having me.
No problem. You enjoyed the views today?
Yeah, it's lovely.
So why don't we start with what's kind of on your mind and we can kind of go from there. Put you in the mirror.
Great.
Here is the
Let me
mirror.
look at myself.
Yes. We're talking about lips today, right?
Right.
Lip enhancement. I'm only going to enhance the M. I call this the Cupid's, it's the Cupid's bow, and I call it the bow and arrow technique.
Yeah.
And the reason why we do that is that by just making this arrow portion, this M, enhanced, it'll make your lip have more body and more fullness and more shape.
Right.
Big lips alone are not beautiful.
Right.
Big lips can look duck-like, they can look fish-like, they can look like a joker, but if you
Agreed.
really shape them and do a shapely lip with fullness, it's actually a much more beautiful lip. So if I can match your lower lip by making the upper lip shapely and to the same size, it should give you the result that you're looking for.
Yeah, exactly. Just a natural, elevated look.
I think that will really bring up a lot of the volume back to the face and give you like a youthful look as well as a kind of a beautiful look. And and it'll look conservative so people don't kind of feel that you look different.
Right.
Okay?
Yeah.
I also want to talk about these columns here. These are flattened. I do want to put a little filler up into the columns to give you a little bit more lift elevation.
Yeah,
And
I
it'll be
know.
really
That's what I
subtle.
feel like. My lip is just face down, I feel like.
It's really important to get this part well balanced because this gives the proper shape of the lip as well enhances the beauty of the lip. And the best part is, it does not hurt.
Patients always tell me that, oh my gosh, it's going to hurt.
Right.
It's overall a fun procedure.
Right.
It should be fun.
Yeah.
You're going to get an enhanced lip and you're going to have some fun with it.
Yeah.
So it shouldn't be causing any discomfort. So my protocol is that today we're going to put a little numbing medication through the mouth. It's called a dental block.
Right.
And I'm going to make sure that your lips are totally completely numb.
Right.
The good news is you won't feel anything. So it's a really comfortable procedure.
Okay.
Bad news is that you'll feel numb for about an hour. But that will go away.
Right.
Again, conservative is what you want. One thing about me is I'm very conservative. The good news is that it's going to be reversible if you didn't like it, which I would say that you're not going to not like it. But at least you feel that, and it's also temporary.
Right.
Okay?
How long does it last?
The product itself should last about a year,
Okay.
but the cosmetic result, it truly depends on every person because it comes down a little bit and patients say that, oh, it's gone, even though it's still bigger than what they started with. 3 to 4 months, up to 6 to 9.
Okay. Do you ever show anyone like different types of lips that they want, like images of?
That's a great question. Picking a set of lips for you, it's not
doesn't make
exactly. It
sense,
doesn't,
yeah.
I mean, it would be fun, and you could probably find a set of lips that look great on you. But the point is that you have somewhere I'm starting. So what I'm doing is I'm taking your shaped lips, and I'm just going to enhance what you already have. And with that, it'll naturally balance and look good.
Right.
Because I'm not trying to change your lip shape. And I'm very conservative, and you can always get more in the future. And I rarely have I gone where too far.
Right. Okay. Let's do it.
All right.
So for my bow and arrow technique, there are 3 important steps. Number 1 is patient comfort. I think a patient's comfort is most important. There should be no reason for a patient to be in any pain during a lip enhancement procedure. I completely numb the area and you will feel no pain at all.
Hold Gladys's hand. She's a professional hand holder. Close your mouth. Good. Your lips should start getting numb here, here, and then lastly, this is the last one I placed I injected.
Okay.
So are you numbing your lip at all?
Yeah. My lips are very numb now, so.
Good.
Good.
All right.
Number 2, the technique. I use a blunt tip cannula. It minimizes the trauma to the lip and also has no risk of penetrating through the lip when I'm injecting. I also like this technique because I'm able to address every part of the lip through minimal amount of needle holes. I actually only use 6, 1 on each corner of the upper lip, 1 on each corner of the lower lip, and the final 2 are up in the upper lip, which is the Cupid's bow and arrow, which truly is the trademark part of the technique. The blunt tip is placed into the upper lip and I actually use a surgical threading approach. And I thread the filler into different layers of the lip in sheets rather than micro drops. This truly allows me to get the most smooth, enhanced lip possible. Number 3 is the shaping of the lip. A beautiful lip needs to enhance the M portion of the Cupid's bow and arrow portion of the lip. I inject the peaks of the upper lips, and I also go up into the columns, up into the lower nose, and this is truly the part of the Cupid's bow and arrow technique that gives the proper shape of the lip. I then massage each part of the lip to make sure the filler is placed in the right region, and finally, you see you have a beautiful enhanced lip.
How was it? Scale of 1 to 10 pain-wise. 10 is most painful, 1 is easy peasy.
It was 1.
All right, great. Oh, we should say 0. 0 is the best.
Oh, sorry, 0.
Okay, perfect. We'll take 0. We will take 0.
It really was.
All right, let's do the reveal. Let's show her. Let's clean her up, and then let's show her.
Let's clean it up.
And you are officially done. Congratulations. Okay, take a look.
We're gonna sip it. Here we go.
Oh my god.
What do you think?
I love them.
They
I
look
love them.
great, right?
Mhm. It's exactly what I wanted. Just like a elevated. You did good.
Pass
You
the
did
test.
It's
You did
very
well.
natural.
It's one shade, maybe a little too exaggerated, but that's good.
Right,
As long as
no.
you like the shape, you're gonna love it because it is gonna come down and settle in with your face. You can put makeup on right away, and I want to see you in approximately 10 days, somewhere around there.
Okay.
Just to make sure, and just so you're aware, this is gonna come down quickly.
Right.
And I think we have your bottom lip match your top lip. Congratulations.
Thank you. I love it. I'm very happy.
How was that
But-
first week with a little swelling and bruising?
You know, it was fine. I was expecting it all, but yeah,
Was it more or less than you expected?
I think it was less.
I'll consider that.
I mean, it was like putting on chapstick may hurt like a tiny bit, but
wasn't too bad. You got through it okay?
I got through it okay.
All right, well,
Yeah.
now how do you
I'm glad
feel?
I did it. I love them. They're so natural. Just give me that little boost of confidence
Good.
that I was
and
looking
you
for.
do have that little sense of confidence. You're not.
I really do. Like putting on lipstick, I just like the way it looks better.
Have you tried a new
I'm
color?
hooked. I called my mom and I was like, uh-oh, I'm hooked. I'm gonna have to do this every.
We love to have you. Specifically about your lip, I remember that we had a very thin upper lip. Lower lip was fairly decent, but we did give you a little bit of a pout, which I really think it looks great on you. I think when you do a big smile, yeah, I like that. So it actually
Yeah.
has some good mobility. Your upper lip, we did the bow and arrow technique, which we discussed, and really working on the shape of the lip, which is more important than size. I'm truly happy with the results if you are.
I love it.
I love the confidence that we just saw in Sophie. This is exactly why I love enhancing lips. Thanks for watching this episode of Plastic, and continue to follow me on social media. We'll see you next time.